Knock knock. I'm Mr. Tran. I'm Pablo. I'm here to insert the NG tube to relieve your stomach pressure, and I'm also here to give you a shot of heparin to help you with DVTs and blood clotting and everything. I just wanted to state before anything that I checked for precautions. I checked for any allergies. He's allergic to silk tape, and I already drawn up the heparin. Heparin, he's taken the orders for 5,000 units per ml. So I drawn up 1 ml right here, and it's ready to go. I would go and provide privacy, do hand hygiene and put on some gloves. And I'm gonna start with the heparin shot. I'm gonna get this ready here.
I'm zooming in.
Okay, so this will be administered on your belly, okay? So I would just wipe the area. "30 seconds, 28, 29, 30. Let it dry.
Can you move the lubricant bottle?
Mm-hmm.
There you go.
Okay, here comes a little prick. Go 45 degrees. All the way down. Perfect. Put this in the Sharps container. Just gonna reuse it for the sake of the video. Just scoop this. Okay, so your heparin shot's done. Now I'm gonna go ahead and just to make sure I verified the 5 rights. I verified before I administer the shot. I verified against the MAR, and the order is correct. So I checked for the right patient, right medication, right dose, right route, and right time. And now I'm gonna do the NG tube. Okay, I'm gonna put this in here. I'm gonna lift his head up a little more, so in the better position. Are you doing okay, Mr. Tran? I just want to state too that before I administered the shot, I would have verified the patient ID against his bracelet and asked the patient to state his name and date of birth, which he did, and I verified the ID. And that would have been done before the shot. I'm gonna put this in here just in any case we have an accident. I have some water here. I'm gonna put the water here. You can suck the water and swallow as I'm inserting the tube. So here's the tube. I'm gonna first measure it. And the way I do this is first go from your nose to your earlobe, and then to your xiphoid process right here. All right, so it's right above 60 right there. So I'm gonna mark it with a tape. Okay, and I'm gonna spray it with lube, and we use this lube here specifically for the mannequin. I wanted to state before I administer this, I also administer pain medication, so this will be easier on the patient. Okay, Mr. Tran, I'm gonna insert this. I'm gonna go all the way to your stomach. You'll feel a little discomfort, but as I'm going in, you can swallow the water. It will help you with that. And also, if you have any issue and you want me to stop at any moment, just raise your hand, okay? Okay. It goes. Yep, keep swallowing. Good. Okay. And as I'm going here, I wanted to make sure it's going in the right place. I've got my flashlight or my pen light. which I don't have with me, so I'm using this instead. So looking for the placement, I see it going through, so you're good. It's going on the right pipe, it looks like, so I'm just gonna keep doing. Yep, swallow the water as I go, just a little more, almost there. Sorry if I'm hurting you. There you are. Okay, so that's the right placement. The tape is all the way up. I can just go ahead and tape this in place to make sure it doesn't go anywhere. Oh, I guess I have tape here. I'm just gonna secure this to your nose. And what I'm gonna do now, I'm gonna get some of the contents from his stomach. Make sure I'm in the right place. So I'm gonna withdraw 10 ml. There we go. Place it in the cup here. And then I'm gonna test the pH. What we're looking for here is between 1 and 5. Make sure it's in the stomach. It looks like it's 3, so it's acidic, and I'm sure it's not in the lungs. That is good. Do you feel any discomfort or anything, Mr. Tran? Just gonna replace this. The better contraption. So this will be better secured. Go around here to make sure that the tubing doesn't go anywhere and hurts you. Okay, so at this point, I would have placed the secured this with the rubber band and safety pin contraption to his shoulder. Would you please just turn all the way to the other side so you have enough slack here? There you go, perfect. I would have secured in here. I don't have a safety pin, but just for the sake of the video, it's right here. And from here on, I would now I would have checked the suction to see if it's working, which it is, but I'm not gonna connect yet because they're gonna come and get an X-ray to see if the placement is correct, and it should be as soon as they come here and confirm that it's in the right placement, I would connect that to the suction, which is gonna be intermittent. From here on, I would have performed hand hygiene, get rid of my gloves, just to state that in between the shot and performing this, I would have done hand hygiene and put a different pair of gloves. I would have go to the MAR, make sure I got everything correct. Get rid of the curtain, just like, remove privacy. Go and document. I will bring the bed down to the lowest position. His head is gonna stay up because it's the best for the placement and doesn't have any issues with that. So, Mr. Tran, is there anything that you need? Any questions? Are you in pain or anything like that? Is there anything that I can do to help you right now? X-rays, they're coming to get your X-ray in a little bit, and you should be okay, all right? All right, I'll see you in a little bit. I would have walked out, hand hygiene, and document.